Okay, I'm about to see John. He is 33 years old, presenting with flu-like symptoms. Skin is jaundiced. He's 6 feet tall, 180 pounds, and gets regular exercise about 3 to 4 times a week, so that's great. Hi there.
Hello.
Hi, my name's Christy.
Oh, I'm John.
Nice to meet you.
Nice to meet you.
Have a seat, please.
Thank you.
How are you doing today?
Well, all right, I guess.
Yeah? Well, why have you come to see me today?
Well, my doctor says I have hepatitis A,
Okay.
and that he recommended that I come see you for diet instructions.
Okay, what do you do, John?
I'm a truck driver.
Oh, okay. That makes sense. I can definitely understand why he sent you to see me today. Did he explain what hepatitis A was?
Yes, but he was very vague. I really don't understand.
Okay, well, I can help explain that to you, and then we can talk about your diet instructions, okay? Okay. Okay, well, first off, I have a hepatitis A flyer for you. Let me grab that. Here you are. Just has some general information, but I'll go ahead and explain too. So hepatitis A is a contagious liver virus whose symptoms include dark urine, decreased appetite, fatigue, headache, nausea and vomiting, and fever, just basically flu-like symptoms. You've been experiencing those?
Yes.
Yeah, I'm sorry to hear that. Hepatitis also causes inflammation in your hepatocytes or your liver cells. Your liver processes nutrients and filters the blood, and when it becomes inflamed, the liver function can be affected.
Is that why I'm yellow?
Yes, that's called jaundice. It's another common symptom of hepatitis. We have heme proteins in our red blood cells, and when our red blood cells die, the heme is broken down and bilirubin is produced. Well, bilirubin is yellow. So the liver, like I said, filters our blood, but it also metabolizes and excretes that bilirubin. And when the liver is damaged from, say, hepatitis or cirrhosis or some kind of other liver disease, it can affect the ability of the liver to excrete that bilirubin, which causes a buildup, which turns the skin yellow.
Was it dangerous?
Well, jaundice in and of itself isn't dangerous. It just kind of makes you look a little strange.
Mm-hmm.
But it is important to find the underlying cause of the jaundice. For example, chronic types of hepatitis such as B and C can be dangerous if you don't take care of yourself. However, you have acute hepatitis A, which means it only lasts for just a short while. If symptoms are severe and tests indicate liver function problems, you can be hospitalized. And in very rare cases, acute liver failure can happen, but I wouldn't worry about that since your doctor has sent you to me. I'm assuming all of your liver tests are just fine. But with Hep A, a mild case can last a few weeks, and a more severe case can last anywhere between 2 and 6 months. But the good news is it will clear out of your system on its own, and you won't suffer any permanent liver damage.
Well, how do you think I got it?
Hepatitis A is transmitted via the fecal-oral route, meaning it's spread when a person ingests fecal matter, even in very small amounts, microscopic amounts, from a contaminated source.
Like, what do you mean? What kind of source?
Well, you're a truck driver. I assume you use public restrooms and rest stops often?
Pretty much exclusively.
Right, yeah. And you may have come into contact with it there. How often do you eat out?
Every meal?
Yeah, I suspected. So an infected person may not have washed their hands after using the bathroom and may have touched some food that you ingested. Food safety is really, yeah, I know, it's not that great. But food safety is really important in the food service industry, but accidents do sometimes happen.
Well, I can't stop using public restrooms. I mean, truck driving is my life. I can't stop eating out, so how do I prevent this from happening again? I don't want to feel like this.
I completely understand. I hear what you're saying. But the good news is, I guess the silver lining here is that you really don't have to take a whole lot of steps to prevent this particular infection because while there is a vaccination for hepatitis A, you no longer need it because since you've already had the virus, your body has produced antibodies, so now you are immune to it. However, it's still good to practice good bathroom hygiene to prevent other types of illnesses from happening.
Well, what do I need to do to feel better? Because I still feel pretty sick.
Right. Well, first off, no alcohol, at least not while your liver is recovering. Metabolizing alcohol is hard on your liver and it's trying to heal. So once you've fully recovered, minimal alcohol, you should be okay.
Oh, good.
If you have nausea and vomiting, I would ask your doctor about over-the-counter medications to help that, or prescription antiemetics to help stop the vomiting. But as far as food is concerned, you can try a modified BRAT diet. BRAT stands for bananas, rice, applesauce, and toast. These things are pretty easy on your stomach. And you can also try ginger ale, Sprite, saltine crackers. It should help.
What if my nausea goes away? If I don't feel sick anymore, can I just eat anything I want?
Well, other than alcohol, there really aren't a whole lot of other dietary restrictions, just a well-balanced diet. But that can be challenging, well, since you're on the road all the time. So let's talk about getting a well-balanced diet on the go.
Oh, that would be great.
I actually have a handout. So handy with all these handouts. This one is basically just tips for eating healthy. It kind of, talks about how many servings of fruit, how many servings of vegetables, different kinds of protein, whole grains versus non-whole grains and things like that. So you can use it kind of as a guideline to help you make healthy choices. It is important to stay hydrated, first off, when recovering from an illness. I know it'll make things a little more inconvenient. The more you drink, the more you need to use the restroom.
Slow me down a bit.
Right, but while you're recovering, hydration is always important, but especially while you're recovering from illness. But just do the best you can. I also have one more handout for you about eating on the go, and I can go through this with you. There you are.
Thank you.
No problem. Okay, so we talked about drinking. 6 to 8 glasses of liquid per day. Water, always an excellent choice. If you choose juice, do 100% juice, not those like juice cocktails. You can find that on the nutrition label. It usually says it right at the top. It has the percentage juice. We're looking for 100%. If it's like 15% juice or something like that, it's basically just sugar water, and that really doesn't do anything for you. Okay. Low-fat milk for calcium, and you can try a sports drink like Gatorade or Powerade, especially if you've been vomiting. It has electrolytes in it that will help you rehydrate. But if you're not vomiting, that's okay in moderate amounts, just it has a bunch of sugar, so just, moderation there. So convenience stores, I assume, truck stops, a place where you have to, get a lot of your meals. So they have like individual oatmeal cups. You can add water to, have some whole grain there. Individual cereal cups with low-fat milk. Protein bars, which actually would be really excellent for you because they're easy to eat while driving. Also, the extra protein will help repair your liver a little bit faster. Cliff bars, power bars, all filled with good protein and fiber.
Yeah, I've seen those before.
Yeah, there's some that are really good. I really like the peanut butter and chocolate ones. Some gas stations do offer fruit, so that's good. Apples, bananas. Nuts are always a great option. Almonds, cashews, walnuts, they contain good fats, and they also will help you stay full longer. If you decide to go the fast food route, I would try someplace like Subway or Quiznos, Schlotzsky, something like that. You can choose a sandwich with whole grain bread and lots of veggies and lean meats. You can get wraps at a lot of different places, salads. I would go, grilled chicken instead of fried on your salad or in your wrap. Smoothies, a good way to get 2 or 3 servings of fruit. Fruit and yogurt parfaits, while they have a little bit of sugar, are good for calcium and don't have too much fat, and don't supersize things. That's okay. When going to restaurants, if it's breakfast time, omelets with lots of veggies, good source of protein. Avoid starchy things like pancakes with lots of syrup and stuff like that. Instead of fries, maybe choose a baked potato or a side salad, or a side of fruit. On the menu, look for items that are described as baked, poached, grilled, steamed, rather than breaded, pan-fried, deep-fried, creamed, and buttered. And then I would recommend maybe getting a small cooler so you can keep your drinks with you, so you don't have to stop as often. But also you can get some string cheese at grocery stores. That's a really great snack. Maybe some celery and peanut butter. And you can always grab some fruit that doesn't need to be refrigerated. Apples, bananas, peaches, nectarines. You can grab some peanut butter, put it on those apple slices, put it on some celery.
I do like peanut butter.
Me too. Me too. Good source of protein. So even though you are on the go, there are options for you to eat healthier and choose things that will aid in your recovery. So do you have any other questions for me?
No, you've really given me a lot of good information and helped me see the trucks, my truck stops in a different way. So
Great.
I appreciate your help.
Okay. Well, good luck with everything.
Thank you so much.
Thank you.